Well, as of next Monday, state employees could lose affordable access to weight loss drugs like Wegovy.
The state says that's due to how much drug manufacturers are charging. I spoke to a UNC medical expert about how not being able to afford those drugs now comes at a higher cost, both financially and physically down the road. Around 24,000 people covered under the state employee health plan were already taking certain prescription drugs that fight obesity when the announcement came that their insurance would no longer pay for them. Now, less than a week away from that going into effect, doctors worry about the impact on their patients.
So treating obesity is an important long-term health goal for most people to either help regress chronic disease that they already have or prevent getting chronic diseases, including cardiovascular disease, which is still the leading cause of death for both men and women in the United States.
Medical issues brought on by obesity, like cardiovascular disease, diabetes, and cancer, can cost insurance companies hundreds of thousands of dollars per patient. But after spending $138 million on weight loss medication last year, the state treasurer's office says the state can't afford specific drugs like Wegovy. Wegovy and Saxenda cost the state health plan $890 a month per patient after a $550 rebate. Dr. Andrea Coviello is the medical director for UNC's medical weight program.
I have patients on the state health plan who, if they lose coverage and they gain weight, that condition will get worse. And so I am very concerned that those people with particularly severe conditions that respond to weight loss continue coverage.
The state says they are still negotiating with the drug manufacturer and CVS Caremark and are hopeful there will be a solution.
I am hopeful to a certain extent that they start with the most needy patients, the patients who are going to benefit the most in the next 6 to 12 months from continuing this therapy. But on the other end of the spectrum, I'm very hopeful that they sort of continue with their prior recognition that prevention is key.
And also, just to be very clear, this does not include the drugs that are used for people who are diagnosed with diabetes.
Good to know.
Yeah.
All right, Russ, thanks.
You bet.